Committee of the whole is called to order. Unfortunately, we don't have a quorum, so we will stay at recess at this time. I thank my colleagues for showing up. Speaker Terai, Senator Frank Blas, and Senator Lujan. Thank you. We will remain at recess. The committee of the whole is called back to order. We have a quorum. With that note, Senator Dueñas, I think you've completed your first round. You're good? Okay. Senator Parkinson, you're next. We're still in the first round. Okay. Senator Barnett, do you have any questions on the first? We're on the first round.
Good morning, Biba Betness. Good morning, panel. Okay. I guess just the first question I have is for the hospital management. We don't want to just bail you out and then be back in the same situation next year or even in the next term. So what do you think are areas of management that we can improve on, and what changes or corrective measures will you take to avoid coming to this juncture again?
Okay. Thank you for that question, Senator. I'll just reiterate also what the OPA speaker, former speaker BJ Cruz, that, he's mentioned that, with our situation, the collection, the billing and the collection, the payers, we're not getting reimbursed 100%. Probably the most would be 60 to 70% from the various payers, including the Medicare and Medicaid. So really the financial side, financial management may be something that we need to then, ramp up and give more support, but it's also linked to our electronic health record system. We launched that system in October, and we thought it was going to be the best product for us, but we're discovering that there are still some issues with it in terms of interfacing the services that are provided by the various areas, such as the patient care units, laboratory, radiology, whatever charges and what services are provided by those various units doesn't always get translated over to the fiscal side. And so that's one of the areas I think is that we need help with, and management and improvement is our electronic health record system. And we are in the process of doing an RFP for a new product that is out there in the market that we think will work best for the hospital.
So would it be fair to say that a lot of this money isn't lost forever? It's just that because of the shortcomings with the EHR that you're not able to get to it now?
It's not that it's not lost forever, because there is a time frame that we can then really get our bills out in a timely manner and be reimbursed for it. There is a time limitation.
Much has been said about Guam Memorial Hospital's mandate to accept all patients regardless of ability to pay or insurance status. So what do you think is a good estimate on a subsidy amount that could be factored into your annual budget that could absorb this mandate? And could you just base this estimate off of what you would estimate if you were to improve your collections?
I'll let Yuka answer that question. Okay. An estimate?
So that's all accounted for when we submit our annual budget request. We do factor in all the costs from all the departments, which is the cost to provide care to anybody that walks into our hospital. And then we also offset that with any projected revenues based on patient census, our per diem rates, our collection rates from all the payers. And so the difference in that is what is our shortfall, and that's what we always request in our budget.
Lillian, in the oversight hearing that took place, I think last week, you had said on the record that we could just close down the hospital. And I'm sure that didn't do anything to improve the people's confidence in our only public hospital. But could you please elaborate on that statement and maybe highlight the areas of patient care that you think have been impacted the most by the hospital's current crisis?
I apologize for that statement, but really, truthfully, because of our continuous struggle with our financial situation, we have vendors clamoring on our door, on our windows to then pay them. And so because of our limited financial situation, we're just very thankful and blessed that some of these vendors, such as pharmaceutical vendors, oxygen, laundry, they continue to provide us the supplies that we need. But of course, we need to reimburse them. So for that reason, it's really very challenging to keep the hospital operational. Even though we do our best, it is challenging. In the areas that we may that you're questioning as far as maybe curtailing some of the services. Perhaps maybe like in the operating room, but I don't recommend that because that is a revenue generating area for us, you know, especially with elective surgeries. That's where we can generate more revenues, and so we really don't want to close that down, but you know, during COVID and during the typhoon, we suspend elective surgeries. So maybe for a short period, we can suspend elective surgeries. But I don't recommend that. But if push comes to shove, if we need to curtail some of the services, that can be one of the areas. That as far as any other areas, I don't think we can. You know, people come to the hospital. It's a public hospital. If you're having chest pains, we're not going to tell you don't come, right? So, and we are the only maternal child health service hospital, and so women in labor, they have to come. They have to come to the hospital, so we can't close that down either.
So it kind of sounds like you're not really clear on the impact to patient care and services in this current hospital crisis. But, you know, when we had the oversight hearing, as I'm sure you know, we had a couple nurses come out and testify specifically about areas of patient care and services that were impacted. Would you generally agree with those statements that were made in that testimony?
There's no denial that there are some areas that get impacted, you know, like the lack of supplies. The facility, when the aircon went out, you know, it impacted. When the EHR went down, that was impacted. But, you know, we really have a great team of workers down there who give their heart and soul, and they continue to provide the best care that they can. Yes, there was an issue about wipes. Like I said, I've been a nurse myself, and I did not have wipes when I was practicing. We have other measures or other things that we can do. So patient care can be impacted, yes, but we also continue to provide the safest care, and we continue to exercise precautions to prevent infection.
Were there any retaliatory measures taken against any employees who testified in the oversight hearing about GMH's conditions?
Can you repeat that question?
Was there any retaliation against employees who had testified in the oversight hearing about conditions at GMH?
I don't think so. And from my perspective, I welcome people to feel comfortable and confident and safe that they can express their concerns, and we welcome that. But we also would like for some solutions and recommendations, and we work together. But some of the people were hurt. They felt hurt, but you know, we're human beings. But no, I don't think that there's been any retaliation. And my message to the managers, particularly the nursing managers, is no, welcome them to speak their minds freely and to bring the concerns so that we can work together to come up with solutions.
Do you think there was any point before now where we're looking at $30 million in the hole with the vendors where you could have come to the legislature and maybe apprised us of the situation that was coming? Basically, why do we wait till we were 30 million in the hole?
Senator, if I can also say a little bit, I'll let Yuka. But at the time in July, when we presented our budget request, we mentioned that we're short. And that's why we look to this legislative leadership for the authority that this legislation has in terms of appropriating what we need to subsidize that hospital. So it's not been a secret. We have been saying it. Maybe we're not crying loud enough, but we have been saying that the hospital needs financial subsidy. Thank you.
Thank you, Ms. Lillian. So the resolution that we just voted on and passed yesterday, there's a piece of language in there that says if we don't declare a state of emergency at the hospital, that it would necessitate the call for a federal receivership. And I saw that you had made comments on that in the media. Can you just explain to the body why you don't support a federal receivership?
I'll be honest, I don't have a full and clear understanding of this federal receivership program or option, but what I have been told, it is quite costly and it is going to cost us more money, and I don't know that really that is going to be the solution. My understanding of a federal receivership is to make sure that there's some control by the receiver, whether it's the federal government or whatever entity, private entity, gets awarded by the court to then, you know, take ownership and control of it, and to make sure that the creditors, such as the vendors that we owe, are paid. And so that's the gist of my understanding of that federal receivership, and that's why I commented that it is going to be very costly.
I think it's pretty clear, and I also saw in the media that you had second thoughts about your resignation.
Sure, thank you for that question. After praying on it more, deeply and intently, and ruminating on it, and the overwhelming support from the staff, from many people, to say, Lillian, don't quit, don't give up, just stay in there and hang in there. So after that, I have made my formal decision and announcement to the governor and to the Board of Trustee Chairwoman, Teresa Obispo, that my decision is to stay on in this post unless they decide to boot me out or say, Lillian, that's okay, you can go ahead and go.
You testified on the record in previous hearings, I think in the oversight hearing, and then also when you guys came down for the budget, that the governor had provided funding and support. Can you again elaborate? Is this separate from the $20 million that has been committed? And just maybe explain a little bit more about the funding that was given and the support.
Yes, every now and then when we really are challenged and our accounts are really low that we're not able to make payroll and the payables, I put my pride aside and I beg the governor, I beg Ed, we need some help financially. And so yes, the governor comes through to help us with our payroll and also with some of the vendor payments.
Have you had any conversations with the governor or the lieutenant governor recently about the current crisis and this emergency session and all that?
Yes, we have. Well, we frequently have conversations where we are with the finances, and the governor does also reach out to us, and we meet on a regular basis as far as to discuss more about our financial situation and our billing and our collections processes and where we stand on that one. So yes, we communicate regularly on that.
Have you made any ask to the governor to increase the amount of ARP funds that she's willing to commit to the Guam Memorial Hospital from the $20 million?
It was the governor who really offered it to us, that, with the legislature introducing a Bill 164 to then the legislature to subsidize us with the $30 million for the vendor payments, that then she's also offered the $20 million to help us with the improvement and continuation of the repairs for the physical structure of the hospital. So we can solidify it and strengthen it if in the event we have another storm, we've completed all those repairs and the renovations.
Have you had any communications with the governor's chief advisor on healthcare relative to the conditions at the Guam Memorial Hospital?
The governor's advisor for healthcare, is that Mr. Dennis Rodriguez?
I believe so.
Okay. I haven't been in communication with Dennis recently, but in the beginning when he was appointed, we've met several times to discuss the whole situation of the hospital, particularly recruitment of doctors and nurses, and also those patients, those individuals who have been in our hospital and occupying the acute care beds when they don't really need to be there anymore. And so we're trying to find out a solution for it, a home for them, such as a transitional care facility for them so that we can decompress the acute care beds so that those in the emergency room will no longer have to be waiting too long to get an inpatient bed. So those have been the discussions with the healthcare advisor, Mr. Dennis Rodriguez. I haven't been in conversation with them lately, so.
I did see, according to Department of Administration documents, that the chief advisor on healthcare resigned effective September 30th, 2023. Were you aware of this?
Saw that news too.
Okay.
Yes.
And was it related to the current crisis at the Guam Memorial Hospital? Do you know?
I have no information on it. I am not privileged to have that information, so
Okay.
I don't know what the basis is and what the reasons are. So.
But you did have conversations with him initially on
in the
this.
beginning, in the
Okay.
very beginning, correct? Yes.
Mr. Kando, I read in the news that you were recently moved into a classified position, and I know that some people in the public would offer the opinion that we're facing a crisis and there are a lot of things that maybe should have taken priority over moving you into a position that gives you more job security. So if you could just apprise the body of the impetus, the process, and the timeline of this event.
Thank you for that question, Senator. So I had been in discussion actually with Lillian on this issue over the last several months. It didn't just come sudden, and so I informed her that I had an interest in stepping down and competing through the merit system for this particular position that I was qualified for, I was interviewed for, and I was appointed to the position. It had nothing to do. If I had a problem with the crisis, the given crisis that we're going through now, I would have asked to retire. And I'm still here, and I'm still fighting the same issues, and I'm still very interested in fighting these issues for the community's only public hospital. I'm not going anywhere. I'm not afraid to front and face challenges. I walk into the fire when we have a typhoon. I don't walk away. I don't stay at home unless I'm told to stay home. So that's my feeling. That's my position.
Was this position, would you say it was created for you, or was this position announced, and was it competed for?
We restructured, we've been restructuring various divisions of the hospital, operations included, and this was a restructure that took place, I think about a year ago. In working with the Board of Trustees, it goes through the BOT HR subcommittee and to the full board for approval. So we had added these positions because the operations division is one of the largest divisions in the hospital. So it's very complex, and all of the different departments are just so different from each other that we just needed more layers of leadership in order to effectively manage it. So
is that a yes? It was tailor-made for you, or
not for me? No. We do not create any positions for any particular individual. We never do that.
If I may interject.
Please, Lillian.
This is a position that was in existence since long time ago, and it was called Assistant Administrator of Administrative Services. And it was a classified position. It was made classified by the former employee who occupied it many years ago. And so in the reclassification of our admin office, we then retitled that to Assistant Administrator of Operations. And that was occupied by Mr. Don Rabinal. But then he resigned and moved to the mainland. So that position was then vacant, to which Mr. Cando said he applied for.
How many applicants were there for that position?
There was another applicant, but unfortunately...
I'm sorry, Mr. Chair. I just feel it's relevant because we're talking about the financial situation.
I just want to make sure we stay relevant to 164. Okay, thank you.
Thank you.
There was another applicant, but unfortunately, the review by the HR, that applicant did not qualify for that position. So Mr. Cando was the only one who was qualified.
Okay.
Thank you.
I was looking over your staffing pattern, and I noticed a lot of inconsistencies with some of these unclassified political hire positions, like the program coordinators. So, in just kind of a cursory review, there doesn't seem to be any rhyme or reason with and maybe you could explain and clarify this, program coordinator 2. So for example, I saw a program coordinator 2 in patient affairs who makes $64,000, but then there was another program coordinator 2 who makes $111,000 in salary. And then in patient registration, there's a program coordinator 3 who makes $59,000, but in skilled nursing, there's a PC 3 who makes $73,000, but in radiology, there's a program coordinator 4 who makes just $61,000.
If I may correct you, sir,
Please.
Those are not political hires. The program coordinator that you're referring to who's earning $100,000, that individual has been employed with the hospital as a staff nurse. But she opted to step down from that position, and we needed her expertise to help us out in the fiscal department with regards to some of the claims that get denied, because she has that experience in terms of clinical experience and clinical knowledge that she can then go back to those records of those patients, of those claims that the insurance deny. So we're using her expertise because the individual stepped down from being a staff nurse, didn't want to work the floor anymore, so we shifted her over there. But because of her years of experience, that's why her salary is that high. So, and it's not a political hire.
Unclassified? It's an unclassified position?
She's a classified position.
That's a classified.
She's
okay.
classified.
Okay, so I'm just trying to make sense of the different amounts. So are you saying that you use these program coordinator positions to put people that would otherwise hold other titles into?
Not all of them, but that's one example that highlighting. And so I
Okay.
just wanted to clarify that.
Thank you. And then what about the vacant position of the hospital chief planner? Are you planning to keep that vacant?
Well, we announced it, but then, again, we're still not getting applicants for that position.
That's $300,000 a year, right?
$300,000 a year for the chief planner?
That's what I saw.
It's
Thank
more
you,
than the
thank you.
hospital administrator's salary?
Thank you. Thank you, Mr. Chair. Thank you.
Thank you, Senator Brennan. At this point, at this time, colleagues, we're going to take a 15-minute recess. They need to reset the cameras. They're having some technical problems at this time. Thank you. We'll be in recess for 15 minutes. Committee of the Whole is called back to order. We'll now proceed to Speaker Terlai. You have any questions for the panel?
Yes, I do, Mr. Chair, and thank you. Thank you to the panel for being here on time this morning. I appreciate that. Should we hold our questions for BBMR and the documents that they sent out, or? But I can begin with GMH.
No, they're here, but
All
go
right.
ahead. You
Yes.
can-
So, first of all, the governor sent a letter to us discussing that there's $20 million in ARP that she's going to give the hospital. Have you received that? No?
Not yet, because I think
It's not been
contingent.
delivered to you. Do you know when you will be receiving it?
My understanding is it's contingent with this Bill 164, that the 30 million was going to be appropriated, and that she was going to then supplement it with the 20 million specifically for the structural repairs. That's my understanding.
She's, in an interview that you gave the news, you said the 20 million will be used for structural repairs, and the 30 million, if it's given by this bill, is going to be used for vendor payables. But you're saying the governor's not going to give the money for the structural repairs unless the legislature passes a bill for vendor payables?
That's not what I'm saying. At the initial conversation, when the governor called me up, was that this is going to be something that she is going to put forth on the table, the 20 million, to help the hospital. And then the 30 million that's coming from this legislative body is then for the vendor payments. That's my understanding.
Do you need the 20 million right away?
Well, we have a plan as far as what those structural repairs that are going to be prioritized, but if we could get the 20 million now, definitely we'll use it, yes.
All right, but she hasn't given it to you yet. And you're saying it's contingent on some other future
That's my
action.
word. That's my interpretation.
Okay. What about, before we had the oversight of the GMH, was the governor aware of your situation, that you needed 20 million for CIP and 30 million for vendor payables?
We did not discuss that, particularly it was something that she proffered when she had the discussion regarding this Bill 164.
So she was not aware of your situation. Actually,
She is aware of our situation. She's always aware of our situation.
okay, so was she aware that you needed the 20 million for CIPs?
I didn't say 20 million. That was not the figure I gave her, but we needed funding.
Okay.
Sorry.
And was she aware of the 30 million in vendor payables that was still outstanding?
Yes, she's aware.
She was aware before the oversight hearing.
I'm not sure if it was before, but I had a meeting with her, and that this is what I discussed with her as far as the credit on hold amount of money
Yeah.
that we know, that we were informed. And so collectively, at the time when I met with her, it was something like 26 or 28 million was what I had mentioned.
I remember there were several hearings. So there was a budget hearing for GMH where they outlined their budget. The governor had at that time requested status quo budget for GMH. OFB came out with $8 million more than that status quo for FY24. But at the time of the budget hearing, we saw that there were $100 million in non-billed because, and then you got that's where we first heard the explanation that it was because of the system shutdown, that happened, was that in March? Yeah, when the whole system was shut down, they lost time to send out bills, and then that transition to the new EHR in October, that's 1 year ago, that was causing, not able to interface with the billing, so that was causing a delay. But I remember very clearly asking you, and Yuka, you said, we are going to make that up. We are working on it now, and that's our plan. In fact, I asked you, how are you going to make up this increased revenue in the new fiscal year? Because you asked for, I think, $24 million increase in revenue, or you projected a $24 million increase in revenue, and you said because we're going to make up for the bills. And you had a plan, and the plan was acceptable to us, right? But then we came in for a budget budget session. That's the second time GMH came in, was the budget session. And during the budget session, you talked about, the billings and the EHR system again. And I had asked you specifically, and I'm going to read from but this is a rough transcript of our budget session. And it says, this is me talking. I think during the budget hearing, we discussed that I think you were 100 million worth of billing that was not done or needed to be done, something like that. And I asked you, how are you going to make up for this billing? And you said, oh, we're going to be able to do that, yeah, in the upcoming fiscal year. And you still believe that's possible? That's what I asked you during the budget session, and you said, we're doing it right now, Senator. We have the staff working diligently. I've even authorized overtime for them to really get these claims out the door. We've also detailed others in other areas of billing to come and just work specifically on billing so we can really push them out and get them caught up. They're very motivated. I'm proud of them. It's materialized to a significant billing production this month. So it's actually looking very good. And so then we talked about other things. And it was really not until the oversight hearing when we were told we can't do it, right? That we need the help right now in order to get these these vendor payables taken care of, and or we're impacting patient services. So I acknowledge, I see that, and that's why we are here today. However, Mr. Chair, if OFV could just confirm that what I'm saying is correct, that the governor's request for the hospital for FY24 was status quo.
Good morning, Senator. Yeah, just for the record, the governor's executive budget that was submitted for FY24 shows a slight, roughly 1.2 million increase in the BBT. In the GMH FY24 budget submission to the legislature, it reflected a $33 million appropriation level for the pharmaceutical fund. I'm not sure how they determined that 33 million appropriation to the pharmaceutical fund, where historically they've only gotten like 17, 18, 19 million over the last several years. So to your question, I believe the executive budget was basically almost status quo to FY23, yes.
All right. And you gave them more? What did we end up giving them? Status quo?
We gave them approximately 8 million more for FY24.
All right. And we believed their plan of how they were going to make up for these billables. But I'd like to talk about the EHR. So this EHR new system had been on the list of CIP projects that the hospital needed for several years. To my memory, maybe before that, but at least, very least since 2019. You implemented it in October last year. I'm guessing that there were expert consultants, and they were consulted, and either we were told in the oversight hearing that now you're going to go out for a new EHR. You said this morning you have an RFP for a new EHR. And so I'm trying to figure out, did those expert consultants make an error? Did they not anticipate or plan that your EHR system has to interface with your billing? Or were you planning, like I think in the transcript, I read that you could also discuss to us that we're going to try to interface it. There's another step to this EHR system, and that is to interface these two. So I was very surprised at the oversight hearing to hear we're not doing that anymore. We're going to do a new RFP for an entirely new EHR system. So I'm concerned.
Your time.
The time is up? All right. Thank you, Mr. Chair.
But I'm going to ask the panel if they can answer any of the questions that was imposed, please.
Well, I'm not done with the question, Mr. Chair.
Okay.
It is, if we consulted an expert, how are we not going to make that same mistake going forward? What kind of experts are we consulting? Who is in charge of this planning that made an EHR system that doesn't interface? And we see also on the list of vendor payables that the EHR vendor is one of those that is not being paid. How are we going to afford a new EHR system and a more expensive one probably?
Okay. If you can just answer that, and then no more questions, then we'll move to the next senator.
Okay. First of all, I just want to also say good catch on that, Senator Barnett. That is an error in terms of the chief planner earning $209,000 99,000. That's an error, because it was right at the list what the physician salaries are, and it may have been then mistakenly plugged in. So thank you for that catch. Speaker Talahi, in terms of our EHR, yes, there were expert consultants in that group. When we were told by Cantata, who was our EHR product, we were told that they were sunsetting. So when we were informed about that, they referred us to this MedSphere company that they are affiliated with, and so we went through the novation process for their product. We didn't go through the RFP process, we went through the novation process. And they came to the hospital with their experts, with their panel of clinical experts, pharmacists, nurses, and this is what they sold us, that because they are the experts, this is the product that's gonna work for us. Unfortunately, we discovered that it's not fitting our system, because we discovered that it's an old product that was used by Navy facilities, and it's geared more for behavioral health landscape, not acute care. And so we continue to work with their experts and our team to figure out all those glitches and make sure that it gets built to fit our landscape. So now we continue to be challenged with it, but we have to use it because we have nothing else. This is something that the clinicians and the nurses have to use to document whatever treatment, whatever assessment, whatever notation that they find on the patient. This is the only system that they can use, unless we go manual, meaning paperwork, and the clinicians don't want to do that. So we're making the best of it, but we are proceeding. We haven't yet done the RFP. We are writing the specifications for it. Whatever company response to our RFP, if they are the most responsive and the best, then we'll see how that goes. But yes, we need to have another EHR. And those EHRs are very costly, very costly. Thank you.
Thank you.
Mr. Chair, I had asked also if they were in debt to the current EHR vendor.
Well, why don't we move to the other senator, because two senators already asked, the time's up. I know where your questions go. Senator Paris?
I'll yield my time to the speaker.
All right. Please continue, Madam Speaker.
Speaker, the question is that are we in debt with the, yes, we are. And you can see it in the APs that we owe them about, what, 400? 400 some thousand. So we are behind in paying for their services. Yes.
So how are you going to afford a new, more expensive vendor for EHR?
Okay, that's a good question, but this is, again, as it was pointed out, that, our financial situation is where we need help. This is where
that's to pay past vendors, not future, right? So.
But it's going to be an ongoing process, because as a OPA, former Senator B.J. Cruz, that we don't get reimbursed 100%. And so financially, we're going to need subsidy.
Can you clarify, please, OFB, does the legislature subsidize, does the people of Guam's taxes subsidize the Guam Memorial Hospital? Lester's nodding his head, but there seems to be some misconception or misstatements out there that we are not subsidizing this hospital, that we're not running it under a model that it has to treat everybody. That's the model. It has to treat everybody. We are accounting for that by subsidizing it. And so this notion that the legislature or the people of Guam's taxes are not subsidizing the hospital is false. They should be planning to run it how they know they're going to get their revenue. They know they're going to get less than reimbursement on Medicare, and they should have been redoing the Medicare rates for a while already. Although that, everyone knows. I mean, I just think to say now, the problem is we need subsidy. That's not the problem. We have been subsidizing. It's you need to plan revenue and expenditures to match each other. I want to talk about, just tell me, there's on the vendor list, there was that vendor MedSphere, that's the EHR system, 410,000. There's a Med Farm, 728,000. What is that for?
Pharmaceutical supplies and medical and surgical supplies
There's a MedQuest medical supply. What's that for?
Different types of medication, because not every vendor provides all the medications and medical supplies. So we go with the various vendors and various distributors.
And there's a Med Health Solutions LLC.
That MedHealth solution is the revenue cycle management contract that we had. We terminated that last year, so no longer, but they claim that we still have invoices that we have to pay.
Did you see that, Mr. Chair? We owe the collector money according to this.
Correction, Speaker, they're not collectors.
What were they hired to do?
They helped us with our processes for revenue cycle for the billing, and I can let Yuka expound more on it.
All right, so for the billing that we're $100 million behind on, right?
Yes.
Yes.
They were the consultants for the revenue cycle.
Thank you. I'm just concerned that I don't know who is going to be your consultant for the new EHR system. Mr. Kando, were you involved in procuring of that EHR system? You were the planner. Now you were the administration's officer. Now you're the assistant administration's officer or operations administrator. What role did you have in this EHR procurement?
Of course, I'm a part of the team, so I'm a part of helping with the procurement process. The innovation is it's not an RFP, but it's still a procurement process. So I do whatever I can to help that procurement process come to fruition.
Did they plan? You were the planner at the. Did they plan that the EHR system has to interface with the billing?
Of course, we had a whole team of both clinical and non-clinical folks trying to coordinate with these professional consultants to get the most out of the system. Of course, no system, we found out, there's no system that's perfect in any EHR. And of course, we found out what the imperfections were with this particular system that, were more than I believe usual imperfections that you would find in an EHR that is designed for an acute care system.
A couple months ago in July, you made it sound like you were going to pursue interfacing with the billing with the current system. But it seems like they're giving that up now. Can you explain?
Part of the setback on that is because we owe the vendor, they have stopped supporting us.
Yeah, that's what it sounds like to me. It's not a matter of we're making the best decision or which one works fastest, or it's a matter of we ran out with that vendor because we couldn't pay them, and now we want to go out with an RFP with all these other vendors. Can you tell me, how do we have vendor payables when you do a purchase order or something, don't you have to certify that the funds are available?
Yes, they're certified against the budget amount for the year.
All right, so did you receive your budget amounts?
No, we have been short.
From DOA?
No, not from DOA, just from our collections.
Your revenues?
Yes.
All right. During the budget hearing, you showed us the amount of appropriations you had received over the years, and then that there were still some that you had not received. FY20, I think. Anyways, it's a couple $1 million, and then you showed a little box that says the $10 million also appropriation for CIPs was not received. Now we're hearing the governor's $20 million from ARP not received. So, Mr. Byrne, is there anything to prevent the governor from using $50 million of ARP money to pay for vendors or for CIP projects? And is there any reason why the $20 million hasn't been transferred yet in ARP funds to the hospital for their CIP projects?
Madam Speaker, if I may, I was on the call with the governor and Senator Lujan, and we made that proposal. We committed the $20 million. We sent the senator a letter to that effect, and we believe that Bill 164, the need to act immediately, necessitated cooperation. So we went ahead. I provided you guys yesterday with a roadmap on how to get $30 million, which they need for vendor payments. And then we took a look at the CIP, because in getting into the 30 million, we had to take out the 15 million that was appropriated in 23 from excess 22 revenues.
Could you just answer the question regarding the 20 million ARP funds?
You want me just to answer the question?
Well, yeah. Why, is there anything to prevent it being transferred today or yesterday?
Our agreement was we would work with 164, the authors, to be able to get secure 30, and we would put in the 20.
And what if we can't secure the 30? They're not going to put in the 20?
I don't see why you can't do it, but
Well, is
that's a
that,
different story.
I've never heard of a governor saying we're going to do this contingency. Do we need the roof to be repaired? Lillian listed roof repair, or do we not?
6 members of the minority putting together a budget, a bill to help GMH, prompted the interest of the governor to help, because she saw the minority supporting GMH. She hasn't seen that before, so she jumped on it.
That's hilarious, Lester. She has not seen money being appropriated for GMH from the majority. What about for the last 4 years?
I said the minority.
Okay. Well, so we're going to wait for something else to happen before the GMH gets the 20 million that Lillian says she's going to use for roof repair and other very critical CIP projects.
Hopefully we don't have to wait any longer than today, Speaker.
Is there anything to prevent the governor from putting 50 million in ARP funds for GMH?
If this legislature doesn't help with the vendor payments, then I don't see what good this is doing.
Is that not an answer to my question, Mr. Chair?
That's an answer. That's my answer.
Mr. Byrne, is there anything to prevent the governor from putting 50 million in ARP money to GMH for eligible ARP expenses?
Speaker, what's an eligible ARP expense?
Pardon?
What's an eligible ARP expense?
Don't you know that?
But
Isn't that your role in this whole government, is to make sure it's eligible for ARP?
Well, I was trying, both of us here, Madam Speaker, are trying to answer your question.
Okay.
But I can't if I don't understand it.
Okay, I'll say it again. If the governor can transfer 20 million in ARP to GMH for CIP projects, can she transfer 50 million?
I'm sure she would consider whatever she has to consider. This seems to me to be, and if I can pick up on my colleague's response here, a shared responsibility. If we don't spend, if we have to spend more ARP money, then there's less ARP money for what she originally decided to use it for. That's not a decision I'm sure she wants to take. As Mr. Carlson said, he spoke with Senator Lujan, and this was the agreement that came out of that discussion. If the agreement doesn't go forward, then I guess other decisions will have to be taken.
Can the governor transfer ARP money to pay for a brand new EHR system?
I would have to look at that. I mean, I don't think, right, all these ARP monies are not going to be spent tomorrow. These are all capital projects or long-term projects. So yes, it might be considered. Even GMH might want to consider paying for an EHR system out of the ARP money, but it's not going to happen tomorrow. The money's not going to be spent tomorrow.
It looks like it's not going to be delivered tomorrow either. Mr. Carlson, can you please explain, you passed out a document yesterday that you said was your proposal of how to adjust FY22 general fund excess appropriations on pages 13 and 14, and that's how the $30 million of excess FY22 money is going to be found. It's from current appropriations. Could you just please explain those pages 13 and 14 of the handout?
Okay.
Does it mean deappropriate from these uses in order to get the hospital, and there was no other funding source that you could find? What about the 10 million? Is that available? Is that going to be transferred?
About 10 million. What 10 million?
The 10 million for capital improvement projects, and then there was, I think, 15 million for the labor and delivery ward, and there was 5 million for the hiring of experts, yeah,
see 10, no.
medical experts, specialists, and looks like,
Okay, if you don't mind, for the interest of the body and time, we provided you with a summary sheet, so it's 8.5 by 11. It talks about what material is contained on what page numbers. I'd like to be able to start by saying that the appropriations versus expenditures from 22 general fund excess revenues are contained in pages 8 through 12, so that you know everything that the body passed, which exceeded revenues collected by $19 million. Mr. Byrne, in his draft audit, confirms that there was an overspend. So as Speaker, Public Auditor Cruz mentioned yesterday, in response to a question about cleaning up appropriations, he was very much in favor of cleaning up appropriations.
he also said we would have an excess, didn't he?
But he didn't tell you how much. And so we're not banking on an excess. We're banking on what we did in fiscal years 22, 23, and the information that you have been consistently getting from the CRER and the special fund report. So moving on, if you go to pages 8 through 12, or 8 through 10, you'll see where there were appropriations beginning with the Health Professional Licensing Office under fiscal year 23. They were provided $283,581. They expended $121,179.03, encumbered another $66,000, and had an appropriation balance of $96,181.43. So moving through this next couple pages, anything that you provided these agencies, and I'll refer again to the continuing appropriation list, none of them are on there. So there are appropriation balances that we took, and then cumulatively, they ended up on page 10, $20,183,000. So by taking the appropriate step and de-obligating things that really have no continuing appropriation or any other waiver from the legislature to continue using the money, we went ahead and balanced 22, leaving a excess revenue in 23 that we're using to be able to fund the hospital, ensuring that special funds of $13.4 million are covered, and you'll see that reconciliation on the very front page, and you'll see it again in more detail on page 16. So the whole idea from our perspective was to find a way to provide $30 million for vendor payments, and we believe we've done that.
You didn't talk about pages 13 and 14.
Ma'am, after he answers it, we'll move on to the next senator. Your time's up. Mr. Carlson?
The title on page 13, it says, this is from the fiscal 23 Budget Act. These are the fund sources utilized to be able to make the recommended adjustments that total on page 14, $19,153,316. The only source that we deobligated that wasn't money not spent, which again, no continuing appropriation, was the $15 million for the Capital Improvement Fund. Our logic was that we're giving from ARP $20 million. So this $15 million and the application of that money towards the needed repairs isn't lost. It's just coming from a different fund source with $5 million more.
Thank you, Mr. Carlson. Your time has lapsed already, Speaker. And at this time, it is 11:32. We will recess until 2 o'clock.
Objection?
Objection to the recess?
Well, these are two questions. The recess is non-debatable, but the time is.
Yeah.
Right, so I'm objecting to the recess.
She won't be able to.
Well, I know, but nobody in the world gets a 2.5-hour lunch except for the Guam Legislature. That's ridiculous. We got to get to work. I am objecting to the time of reassembly. I would suggest 1 hour for lunch.
Okay. I said already we're recessing till 2. Thank you.